Good morning, Chairman Engel, Ranking Member Mack, and members of the subcommittee. I appreciate the opportunity to appear before you today to discuss current health conditions in Haiti and outline the challenges and opportunities moving forward. My testimony is from the perspective of a volunteer physician who worked in Haiti the last 20 years and is co-founder of Project Medishare in the University of Miami Global Institute. Within 24 hours of the earthquake, I was on the ground in Port-au-Prince working with our Project Medishare team, and we created a major trauma and critical care field hospital. We treated over 30,000 staging point for U.S. military evacuations to the U.S. Navy ship Comfort and hospitals in the U.S. and abroad. In June, we moved to an existing community hospital, which continues today to serve as Haiti's only trauma and critical care hospital. In the healthcare sector, the situation in Haiti was dire before the earthquake. That's why 250,000 people died. Today, it's even worse. Preventable causes of death in Haiti range from heart attack, stroke, and maternal emergencies to lack of blood supply, vaccinations, and a bureaucratic logjam in customs. Haiti's plan for reconstruction is focused on decentralization and industrialization. This plan cannot succeed if there is insufficient infrastructure in rural areas to attract people, including investors, away from Port-au-Prince. This also means healthcare safety net in these areas. Healthcare delivery and training need to be integrated nationwide, which is particularly important as Haiti's new health needs have changed dramatically. Prior to the earthquake, there were 5 medical schools and 1 nursing school. Today, there's 1 medical school, and Haiti has all but lost all of its healthcare education infrastructure. Committees have formed led by diaspora, mainly from the U.S. and Canada, who are partnering with the Ministry of Health to rebuild these institutions. But since the Haitian medical system is mainly based on a French curriculum, the participation of the Haitian diaspora is especially valuable. Equally, if not more important than the training of the physicians, will be advanced education of nurses and allied health professionals. Haiti's anemic public health system has long depended too heavily on NGOs, often with a different agenda than the government. Facilities outside the capital were chronically understaffed, poorly equipped, and insufficiently funded. Following of Haitians fled Port-au-Prince and sought refuge in their traditional home communities, placing additional stress on the already compromised healthcare system. Haiti's healthcare system is truly on the ropes. It's important to ask ourselves whether we are attempting to solve Haiti's problems in the same way that have failed in the past, or whether now is the time for new approaches to help Haiti help itself. These strategies must include procurement reform, employment generation, capacity building. Priority should be given to partners who have past experience on the ground, records of success, integrity, and transparency. Today, the picture on the ground in Haiti is both encouraging and discouraging. Avoiding major famine and epidemics in the short term is a very fragile victory. However, lack of fundamental shelter, near collapse of economic sector, coupled with a lack of flow of donor dollars, bodes for a very poor prognosis. Bureaucratic holdups and a lack of focus on the needs of Haiti's masses do not allow for a cure, which must be rapid, skillful, and aggressively implemented. In spite of U.S. citizens' donations of unprecedented amounts of money to help Haiti, there is little to no evidence that most of these dollars have reached Haitian shores or are sticking. It's extremely difficult for any organization that's not a traditional foreign assistant contractor or grantee to get inside the doors of those making funding decisions within the U.S. government. So the answer, Mr. Chairman, is no. We are not moving fast enough to help Haiti. 6 months after the earthquake, millions of Haitians are still living in inhumane conditions with few services available and virtually no prospect of employment or opportunity. The U.S. must change the way we do business in Haiti. Public-private partnerships are essential. Following traditional passive assistance, will only lead to more of the same. Thank you for this opportunity to discuss healthcare issues facing Haiti's reconstruction. Project Metashare and the University of Miami's Global Institute remain committed to rebuild a new and better Haiti. Thank you.
Thank you, Dr. Green. Ms.
Chairman Engel, Mr. Mack, and the members of the committee, I also thank you for this opportunity to testify. I speak today on behalf of the president of Trans-Africa Forum, Nicole Lee, who could not make it here today. To answer your question, are we moving fast enough? I agree with Dr. Green, absolutely not. We are not. It is Trans-Africa's assessment that despite the high level of financial resources already pledged and available, the efficacy of the relief effort has been undermined by structural inefficiencies, bureaucratic inertia, and vested interested parties working to preserve privilege while giving the appearance of change. This assessment is a result of 6 field missions to Haiti, including daily consultation with Haitian grassroots and community-based organizations